With Wisconsin now reporting over 10,000 deaths from COVID-19, Dane County seeing a record 7-day average of case counts. Both state and local health officials are working to get the virus under control. Our own McKenna Alexander breaks down the latest data.
With the new year just days away, millions are looking toward the future. But as COVID surges across the U.S., health officials are forced to focus on the present. Here in Wisconsin, that means closely monitoring local COVID data. Across Dane County, the 7-day average for new cases sits at 497, the highest it's been since the start of the pandemic. This comes as testing providers are booked days in advance, drive-through sight lines extend for blocks, and hospitals are grasping for resources as they near capacity.
And we find ourselves exceedingly full, essentially 100% full. We take one in as we send one out.
A capacity that's now beginning to be felt by already burnt-out hospital staff. UW health officials saying now the packed hospital rooms are made up of more than COVID patients.
This time around, it's like the deck is stacked a little bit higher against us.
The burnout and departures caused by this pandemic also leading to a staffing shortage among hospitals, meaning there are less providers despite increasing patients. But it's not just COVID patients that are filling the hospital beds. UW Health is also seeing patients that have put off procedures during the pandemic, as well as the state's aging population needing additional care. Not to mention a recent rise in influenza infections that officials say could lead to additional hospitalization. Yet another blow to healthcare workers that already feel they're at ground zero. For News 3 Now, this is McKenna Alexander.